Welcome back to another uh, video episode of Achieve Balance. My name is Dave Dancero. I am the founder of Smart Moves PT, and I am also the creator of both the Achieve Balance and No Stroke educational services here on Substack. I have the Believe in Balance podcast that a lot of folks connected with me on that on the last episode I did. It was episode 18, and it was Let's Talk Aging Well in the Home. So since Achieve Balance is all things balance, if your home is out of balance or the ability to stay safe in your home is out of balance, my Believe in Balance fall prevention program really isn't that useful if you don't feel safe in your home as a first step. So, in that episode, I covered the difference between an aging in place specialist or certified aging in place specialist. The acronym is CAPS, CAPS. And then there's also a newer certification, which we're going to cover on this and give you a practical example of how I do it. It's called the AgeTech Specialist, and recently I took a course and became certified as an AgeTech Specialist because the limitations of a certified aging in place specialist those are more physical and solving adaptive mobility and access into the home, maybe grab bars. I would have you refer to episode 18 when I give two practical examples. But a couple of questions came through after that podcast episode about this newer designation of age tech specialist. So there's also I'll put the links to those that podcast and the other content that I did in the video notes here. But for that episode, you can dive into features, examples. The focus was just two quick examples showing the difference between those two specialties. And sometimes you may need both. If you're looking to have someone be safer in the home as a family member, or your care provider or care partner, and you want to be able to make sure that person's safe. Sometimes you might need some physical changes that a CAPS specialist can help you with, but sometimes it's mobility, or maybe it's, most people when they think of technology in the home, they think certainly of fall prevention, or what's mentioned as the acronym PERS, or Personal Emergency Response System. The old method was the commercial with I've fallen and I can't get up. But the technology for home, aging in place is the other buzzword that's often used. It's grown, that the market has expanded now. Technology-enabled solutions cover the map. The market map is growing. There are thousands of products. Every year there are more. That's why I added this certification to keep up and learn what are the appropriate steps and most evidence-based methods, tools, and technologies to help people safe in their home. And I should have started with the fact that I am a practicing physical therapist that is dealing not only with aging family members on a personal side, but also the clients I serve. Many of the clients I serve are, have mobility impairments. They may have progressive neurological disorders like Parkinson's, MS, traumatic brain injuries, stroke survivors, etc. So I wanted to just take a few minutes and dive into sort of when I'm trying to decide or helping a client or a patient in their home. Usually it's because I'm trying to solve a problem of keeping them safe in their home. And when it comes to the technology side, I'm usually trying to solve not only the client's problem, but a family member's problem. The family member might be concerned about leaving their loved one. Maybe it's an aging parent in their home. Maybe it's someone who has an acute injury in the home, a child. Maybe it's for short term, but maybe it's long term to keep that aging parent home safe as long as possible. I'll have to go into assisted living. So oftentimes I use this checklist and then I score it to kind of see where I am in terms of what level of service or what might be appropriate for that particular client or family member, or both. Usually I work with both at the same time. So I call it a Smart Tech Ready checklist. It's something I've adapted from my certification, but I put it into terms that I use when I'm working with a client for physical mobility and goal setting. I try to simplify always in 3 categories. You can't manage what you're not measuring, so I start with measurement, begin to manage, and then move. And when you're working with me one-on-one or you're hiring me for a consult, I break this down, and this is an assessment usually you'll fill out either before I come to you, either via video or physically in your home if we're logistically nearby. But I usually start with assessing the infrastructure under that measurement. Oftentimes you need to know what type of technology that the person has. For example, is it a PC, a tablet? How are they connected? Smartphone, whether or not they have one. Also on both of those, consider the model in the year, because if they have a smartphone and they think it's a smartphone, but it's a flip phone from 1990, it's limited in what you can offer downstream. Do they have Wi-Fi in their home? Do they have a smart TV in their home? And I dive deeper into that, but usually on the quick checklist to score, it's either a yes or a no. Quick screening to start, then we go into management. What sort of comfort level does that individual have with the current technology they own? Their ability to actually utilize that technology may be limited because of some physical or cognitive deficits they may have. So, and then the wants, is it something that the person wants to be more tech savvy? What is their educational level? And sort of what comfort level does the client have versus the family member or care partner have? And then again, going back to the barriers that may exist, are there special technology needs that need to be considered if the person has impaired vision, if there's changes in their hearing, dexterity, holding on certain conditions, for example, Parkinson's. There may be some tremors, there may be some mobility deficits with fine motor skills that they might not be able to manage and tap on a tablet, for example, versus being able to talk into a screen or use a keyboard. And then cognition comes into play. Certainly there's assessments that clinical assessments, you can dive a little deeper, but sometimes they're simple as an additional survey or questionnaire that a family member could fill in to give you more information regarding cognitive level. And then finally get into the third part, which is movement. And we want to get this process started. Once you've started the assessment, need to know, and this is a key part, what kind of support and services or systems need to be in place. Does the family have the ability to support on a small level or a high level? Do they want to be completely independent and manage this in-house after those technology linking services are in place? Or do they want to be completely hands-off because they don't feel comfortable or they just don't have time, etc.? You have to kind of get those answers. And then when it comes down to deciding on the technology tools after a consult, how far into the weeds, if you will, does the family want to be involved? Certainly cost. The more DIY that you can do, the more you can save. But do they want to have technology available and they install themselves? And do they want to be able to do the whole thing soup to nuts, or do they want to be able to try it, see if they can set it up to save money, and they want you available to test and troubleshoot? Also, and mostly important, because all these other steps usually are to be able to um, intervene if there's an emergency. And so, in an emergency situation, does the family want to be connected 24/7? Do they want to keep that network in an alert system in the house that they're responsible? Do they get the alerts and the alerts only? Or do they go to several layers, like services you can offer that would determine whether or not 911 is needed right away? So depending on how you answer yes or no to all these questions, there's a scoring assessment at the end. And usually, 0 to 30 proficiency or tech savviness or tech readiness, that filling out this is helpful, because it will, even before I go in or meet with the client or their family, I'll know kind of what solutions that might particularly fit for their needs. So you have to start with that checklist. Again, we're well beyond in the age of AgeTech now. Hundreds and hundreds of products in every category are coming online now. And that AgeTech market map is growing fast. It's something that I'm interested in, so I keep up with all the new innovation. And if you have listened to the Believe in Balance podcast, one of the things I'm going to be offering as additional services, if you will, is to bring in different providers. Now, I am not connected financially to any of these companies, but it is in my best interest, because it is an extension of my knowledge to the client, and that's how I'm paid for consulting for a client, that I provide the best evidence-based and vetted services, the right tech at the right time, and it can be high touch, high tech, or both, depending on what we go through on the checklist. So again, the services now on the tech-enabled home front are, they cover cognitive care, the level of independence, again, beyond just fall prevention. There are health, wellness, and senior living services that can be built in. That's why, like, knowing whether or not they have a smart TV. Also, I dive a little deeper into what kind of, if they're already tech savvy, how are they using their tech? Are they connecting with their care provider, for example, doing telehealth? Connecting for loneliness is another service, so we can have healthcare providers just checking in for companionship. Also, there's other vendors who help with just communication and relaying and checking in. There's an whole another level of ambient physical sensors. Some connect with your phone, some connect into your watch, but that's kind of what folks hire me for, my consultation services beyond just fall prevention. So I think I'll leave it with that. I'm going to do another video about specifically about fall prevention programs, because we do all this not just to stay in our home, but to stay healthy and fit in our home. So my Believe in Balance fall prevention program is another layer, is part of I do with my physical therapy and mobility services that kind of are big. They're closely connected in terms of, you got to be safe to be able to move. You can't move more if you're not safe in your own home moving. So I think that's all for now. I'll put the resources in this video. You also might be able to listen to this. I might load it up as a audio only version. So hopefully I talked through this clear enough that you get a sense of the appropriate questions that someone would come in and ask you if you were doing a sort of a tech readiness for aging safely in place in your home. So I think that's all for now. This has been David with Achieve Balance. Until next time, stay well, stay on your feet, keep the faith, and keep moving forward. Thanks for watching.